If a woman has had a kidney transplant, what does this now mean for her ability to get pregnant and have a safe pregnancy?
Yeah, so we have a large group of women who are in childbearing years and have had a kidney transplant. And so we have information on thousands and thousands of these women that have gone on to have very successful pregnancies. What I can tell women is usually we would like them to wait about a year at least, maybe a little longer after the transplant, so that their immune suppressant medications can be stable, their kidney function can be stable. But after that, we change them to medicines that are very effective for their transplant, but safe in pregnancy, and there are some. And then they're given the green light.
And their fertility levels are?
Returns to pretty much normal.
If a woman becomes pregnant but she does not have kidney disease, can she get acute kidney failure from pregnancy?
So the most often situation is where we actually find chronic kidney disease in pregnancy and that the women didn't know they had, because what young woman would go and have a blood test or a urine test if they weren't pregnant, going for another reason. So we uncover unrecognized chronic kidney disease in pregnancy in a lot of women. In other women who have no baseline chronic kidney disease, there's risks of what we call acute kidney injury or kidney function going down during the pregnancy due to complications that have nothing to do with the kidney, due to bleeding, due to other complications, and that may lead you to have an acute drop in your kidney failure. And we know now, we used to never hear about these women because their kidney function would return to normal. They would be discharged, they would never really see a kidney doctor. Now through research we're learning that those little dips, however slight in their kidney function over their lifetime, those patients are more likely to get chronic kidney disease. One of the other things that happens sometimes to women without kidney disease and with is something called Preeclampsia. They used to call toxemia, all these different words for it. Blood pressure, protein go up near the end of pregnancy. You need to deliver. And preeclampsia was never looked at as a risk factor for developing kidney disease in the future, and now we know it is a risk factor for developing chronic kidney disease years later, and connecting these women in with some sort of surveillance becomes very important to make sure we uncover the patients that do develop kidney disease and monitor and treat them appropriately.
Well, that's really good information because, that's a term I think many women are familiar with is preeclampsia, and yet probably most of them never think that there's any connection to, potential kidney disease down the road. So is it something that they should at some point maybe get the kidney function test just to see that everything is okay? Would that be a recommendation?
Yeah, I think so. So checking for kidney dysfunctions is quite easy. It's a blood test and a urine test that we usually do for a lot of other things anyways. And if women did that once a year, once every couple of years even, we would be able to catch those women and use treatment earlier. Yeah.